So Cushing syndrome in a minute. Cushing syndrome is due to excessive activation of glucocorticoid receptors. Whenever this Cushing syndrome is due to a pituitary cause, it is called as Cushing's disease. The most common cause of Cushing syndrome is exogenous glucocorticoid administration. Other causes are divided into ACTH dependent and independent causes. ACTH dependent is either a pituitary Cushing's disease or an ectopic ACTH production from a malignancy like a small cell carcinoma of lung. ACTH independent Cushing's is usually due to a adrenal pathology like adrenal adenoma, carcinoma or macronodular adrenal hyperplasia. Clinical features, there are a lot of clinical features, but always remember purplish or violaceous striae, thinning of skin, easy bruising and proximal myopathy are highly suggestive of Cushing syndrome. Investigations. For confirmation of the diagnosis, you can do assay of urinary cortisol levels, either low dose or overnight dexamethasone suppression test or even midnight salivary cortisol levels. Once confirmed, you can proceed with ACTH assay, which will tell you that whether this is ACTH dependent or independent Cushing syndrome. If you are suspecting a pituitary pathology, you can even proceed with a bilateral inferior petrosal sinus sampling. If you are in doubt, you can do a high dose dexamethasone suppression test to differentiate between pituitary Cushing's and ectopic ACTH production. In ectopic ACTH production, even high dose of dexamethasone will not suppress cortisol levels. Now, treatment is, if you are dealing with a pituitary Cushing's, it is an endoscopic transsphenoidal surgery. If you are dealing with an adrenal Cushing's, it is laparoscopic adrenalectomy. Then medical treatment include metirapion, ketoconazole, etomidate, all those drugs. And if you are dealing with a ectopic ACTH production like a carcinoid, you can proceed with surgery of the carcinoid. If it is a small cell carcinoma of lung, you can treat the malignancy.